name is Dao Nguyen. I'm a clinician scientist at McGill University. I'm a clinician at the MUHC, and I'm the new director of the Antimicrobial Resistance Center at McGill. My long-term goal or hope is to better prevent and treat difficult infections, bacterial infections, particularly those that affect the lung. One of our major focus is on Pseudomonas aeruginosa, and that's a top priority critical pathogen, as the WHO calls it. In the long term, I hope that our work on that pathogen will help better diagnosis and treat this infection. We also do collaborations with a lot of other investigators at McGill and abroad. And with that, we hope to find new molecules that are antimicrobial, maybe new biomaterials, and better diagnostic technologies for bacterial infections. The AMR Center, or Antimicrobial Resistance Center, was really inspired by MI4 in its concept. The idea that to tackle really important problems in infection and immunity, we had to tackle it in an interdisciplinary and collaborative manner. So the AMR Center was started in its idea about 2 years ago. As I gathered a number of my colleagues at McGill and the MUHC, and the remarkable thing was that these were not just 2 or 3 colleagues, there were over 30 people that got together in person to express, first of all, their interest in research related to AMR in a direct or indirect manner, but more importantly, to give us a sense that McGill really has a community that is very diverse in its scope, with tremendous amount of expertise across the faculties and disciplines. And that there was an untapped potential for these people to work together. And this scope, I think, was inspiring in terms of what could be some of the innovations and the out-of-the-box type of thinking that could arise, because AMR is really kind of an incredibly complex problem that is not just microbiology problem. And so we really needed, the collective, we needed to think across disciplines. The fact that MI4 was created and exists as it is now, I think, is a testament that my colleagues and the university is invested in infection and immunity research. And that it is a major strength that our institution has. It has created a community to which I have had the opportunity to go to meet new colleagues, to access resources, whether they be scientific, financial, or infrastructure resources that more readily, or that I wasn't aware of before. And I think that it also has helped many of us better recognize that we have a common goal,